Thank you.
Good morning, everybody. Welcome to the RCN webinar. We're going to get started in about 1 minute at 9:01 or 8:01 or whatever time it is. Oh, wait, it is 8:01. 8:02 then, my time. Okay, I'm going to go ahead and get started and go through our introductory slides. Hi, everybody. Welcome to the RCN webinar. It is April 4th. Today we have another Swiss-themed webinar. So we have Sophia Kiselova, who works at EPFL in Switzerland, and then Moritz Wagner, who works at the Communicable Diseases Division in the Federal Office of Public Health in Switzerland. So thank you to both of them for being our speakers today. A few announcements. As always, we want to remind you of some of our ongoing activities at the RCN. We have a RCN workshop on educational initiatives, which is on Monday, April 21st that you're invited to, and Tamina will put some information in the chat on that. We also have a coffee hour on Friday, April 11th for virtual coffee and just a chit chat about WBE. And then we have a journal club meeting, and we'll be discussing this paper on wastewater-based AMR, and that is on Thursday, April 17th. Finally, we have a wikithon on Friday, April 25th. Lots of things happening in April where we're working on populating a wiki that has publications relevant to wastewater-based epidemiology. And again, that info is in the chat. And then next May, or this, I guess, in a month, we have 2 other speakers coming, which are going to be great presentations as well. And we'll be advertising those, one speaker from Mexico and a speaker from Los Angeles. So with that, I'm going to stop sharing my screen and pass it to our first speaker, Sophia, who will go first. So Sophia, go ahead and share your screen. Oh, and also while she's sharing her screen, a note to please put your questions in the Q&A, and Tamina will be moderating Sophia's talk at the end.
Thanks, Allie. Are you able to see my screen without notes?
Yes.
Perfect. Thank you. And thank you for that nice introduction. So hi, everyone. Great to be with you all virtually, sharing this space. And thank you for the invitation to speak today. My name is Sophia Kiselova, and I was working as a scientific assistant at the Laboratory of Environmental Virology at the Swiss Federal Institute of Technology, Lausanne, or EPFL, for the past 2 years. And I'm very happy to share some of the work that I and my team were doing with you today. So while at LEV, the acronym for the laboratory, I was working with my supervisor, Tamar Cohn, and also our colleagues at the Swiss Institute of Aquatic Science and Technology to really better understand nationwide perceptions of wastewater monitoring across Switzerland. And I'm happy to share some of our preliminary findings with you today. Just a quick note before we begin. Please do note that the data and the information that I'm sharing with you today is pre-published and is still subject to further review. So just a quick overview of what I'll be discussing today. I'd like to first talk a little bit about the project that my colleagues and I have been working on, kind of the context and the larger objectives that we had in mind. And then I will go over some of the survey methodology that we developed together before going into a description of the study participants of the survey, and then eventually 7 key takeaways from the survey and kind of where we go from here with what we found. And throughout the presentation, we do have a poll for you and some questions to kind of interact with you a little bit and gauge your opinion. So I welcome you to engage with that poll if possible. So firstly, let's go over kind of the context and objectives of this project. in Switzerland, we have seen a pretty rapid expansion of wastewater monitoring, especially since the COVID pandemic, which, wow, 5 years ago, hard to believe. We also know that wastewater monitoring really is inherently linked to the data that the Swiss population is generating in the form of sewage. However, little is really known about the Swiss public's knowledge and attitudes towards wastewater monitoring. And we wanted as a team to kind of develop a tool to understand the Swiss public's knowledge and attitudes of wastewater monitoring, to develop more relevant communications materials and also to build trust with the general public on this topic. So let's dive into the project objectives a little bit. So we had 4 main objectives. Firstly, as I've mentioned, we wanted to kind of gauge general awareness and acceptance of wastewater monitoring among the Swiss public. Secondly, we wanted to understand in a little bit more granular detail what attitudes towards monitoring wastewater were for different diseases, different drugs, different pharmaceuticals, and also various lifestyle indicators that I will get into a little bit later. Thirdly, we also wanted to understand kind of attitudes towards the scale and location of wastewater monitoring, again, to get into a little bit more depth with perceptions and knowledge. And then lastly, we wanted to explore how general privacy attitudes and also maybe how general trust in public institutions, such as the Swiss Federal Office of Public Health, might inform the variation that we saw in general acceptance of wastewater monitoring. So those were the general kind of project objectives we had in mind going into this project. So to measure these objectives, we designed and distributed an online survey. And I'd like to share with you a little bit about how we went about doing the survey in the form of methodology. So the format was a cross-sectional online survey, pretty popular nowadays. And we included adults 18 to 79 that are living in Switzerland currently, and of course, who consented to participate in the survey. And then to actually collect the data, we partnered with a professional survey panel company called Belendi to distribute the survey to their existing pool of about 80,000 members living in Switzerland. And this was done in January of last year over the course of about a week. The actual survey structure included about 32 items or 32 questions that were distributed in the 3 major languages, main languages in Switzerland: French, German, and Italian. So lots of translation work happening behind the scenes. And to actually ask the questions, we used mostly Likert scale style, a few true and false questions, a few rating scale questions, nominal fill-in questions, and then at the very end, an optional open-ended question, from which we got quite a bit of interesting data, actually, that we'll discuss later. And then we wanted to ensure that our survey was representative. So to the survey panel company, we specified that we wanted to have about 1,000 survey participants, and we wanted to have it be representative in terms of age, gender, and also language region. So again, German, French, and Italian. And then this is just a little screenshot of what the participants might have seen when they received the initial contact email in terms of the survey. So they would see the incentive, the amount of time it took to take it, but they did not see the actual subject matter of the survey until they went to the consent form. So let's get into the fun stuff now, some of the initial findings from our survey. So we did manage to get 1,000 clean responses after cutting through some of the raw numbers, which 1,000 is actually a great number for data visualization, by the way. And now I'd like to share with you a brief glimpse of the survey participants in terms of sociodemographics. So the average age was about 46 years old, which is slightly older than the Swiss national average. In terms of language region, the German-speaking region of Switzerland was slightly overrepresented compared to the national averages. In terms of gender, we had 499 females, 500 males, and then 1 participant who identified as non-binary third gender. We had slightly overrepresented Swiss citizens, so about 90% were Swiss citizens compared to 73% nationally. In terms of educational attainment, we saw that participants had a slightly higher educational attainment than the national average, which is quite common in online surveys. And then in terms of employment status, we saw that the number or the percentage of participants who were employed full-time, part-time, or self-employed was almost exactly the same as the national average. And then in terms of income, this one is a little bit interesting. Household income was a little bit lower than the national income. However, this one is a little bit tricky to measure because we created bins for measuring income. However, this was to avoid some of the stigma in Switzerland that's associated with reporting exact monthly income. So we think that our income was about on par with the national average, a bit lower, but it's hard to exactly measure. And then average household size in the participants was slightly higher or larger than the national average. And we did collect a little bit more information that I won't go into granular detail here, which was canton of residency, which is kind of like a state, the number of children in a household, and then political affiliation as well. So now I'd like to share a few, or 7 to be exact, key takeaways from the survey itself. So we saw that participants rated their general awareness of a couple of different items: wastewater monitoring, air pollution monitoring, and drinking water testing. And we wanted to compare how awareness of these 3 topics varied. So I'd like to, if I may, maybe ask Ali to pop up the first poll here. How do you think the awareness of wastewater monitoring for, wastewater kind of compared to air pollution and drinking water testing? And it's okay if you see multiple questions for the poll, you can fill them all out right now, and I'll just give you 2 minutes or so here to fill those out, and then I'll continue. So again, how do you think awareness of wastewater monitoring compared to awareness of air pollution monitoring and drinking water testing? I see a couple of results coming in here. Okay, just give it another couple of seconds. So from my end, I'm seeing that most people are saying lower than awareness of air pollution monitoring and drinking water testing, but we do have a little bit of variation here. Thank you very much for filling out that poll. What we ended up seeing was that there's a general very high awareness of wastewater monitoring, a little bit higher actually than air pollution monitoring, but not quite as high as drinking water testing awareness. But overall, these are the percentage of participants who were aware, somewhat aware, or very aware of wastewater monitoring in these other questions. It's great to see that there is quite high general awareness in Switzerland. And thanks again for responding to that poll. So we know that general awareness of wastewater monitoring was high, but what about general acceptance of wastewater monitoring? We wanted to get at this question too.
And Sophia, you can see the answers to that poll question too, that I posted if you want. Can you see that?
Perfect. Thank you very much, Ali. I will get to that in just a couple of slides, and y'all can keep filling out that poll if you'd like to, if you haven't had a chance to yet. Thank you. So we also saw that general acceptance of wastewater monitoring was really high, almost the same as general acceptance of wastewater monitoring, with about 87% of participants feeling that it's slightly acceptable in that very light blue, acceptable in medium blue, or very acceptable in that dark blue for public health professionals to use wastewater monitoring as a public health tool. So great to see that both acceptance and awareness are quite high for wastewater monitoring in Switzerland. So as I mentioned at the very beginning, we wanted to get to not just general acceptance and awareness of wastewater monitoring, but we also wanted to understand if there was any variation in terms of acceptance for monitoring wastewater across different items, at various facilities, and also at different scales. So let's get into that a little bit too. So key takeaway number 3, somewhat unsurprisingly, we did see that acceptance for monitoring wastewater varied across different items. And you might have taken the poll already, but I'm just going to go through this with you. So we asked participants to rate their level of acceptance for the following items. And no, the emojis were not included in the survey, although it was fun to look all of them up. We had things ranging from alcohol consumption to household cleaning products, non-communicable diseases, prescription drugs, terroristic threats, and even tobacco consumption. And as I've asked in the poll here, I'd be curious to know which items or item you thought had the lowest level of acceptance across all of these quite different indicators. And it looks like it looks like you all said prescription drugs would be having the lowest level of acceptance and then caffeine. Let's go ahead and take a look here and see. So we saw that environmental toxins and then infectious diseases and terroristic threats had the highest level of acceptance. And then conversely, birth control, obesity indicators, muscle building supplements, and caffeine consumption had the lowest level of acceptance for monitoring in wastewater. And we're wondering if maybe this would have to do with kind of things that are seen with the common good, like monitoring for things in the environment or monitoring for infectious diseases like COVID-19 or SARS-CoV-2 could be kind of seen as maybe for the common good and less associated with personal lifestyle behaviors, whereas things like muscle building supplements and caffeine consumption really are more associated with personal choice, and there might be more privacy concerns associated with those topics. But this warrants some further surveys, I think. And then getting into our second kind of granular topic, which is monitoring across different facilities. We wanted to ask participants how they felt about monitoring wastewater in the following facilities or locations, if you will. So we had airplanes, airports, colleges, universities, and technical institutes, hospitals and clinics, residential buildings, nursing homes, offices, prisons or jails, religious facilities, rest stops or truck stops, schools, and of course, because we're in Switzerland, we had to ask about trains too. And here comes in the last poll question. I'd be curious to know which facility you thought had the lowest level of acceptance for wastewater monitoring across these three. And let's take a look at the poll here. I think you've already filled it out. It looks like by and large, about 75% of you said religious facilities would have the lowest level of acceptance, although we did see a little bit of variation. So let's see. So we saw kind of similar, I would say, to monitoring the various items. Facilities that were associated kind of with the common good and with maybe public health as well, like hospitals and clinics, nursing homes and airports were associated kind of with the highest level of acceptance, whereas facilities that are more associated with personal lifestyle, like offices, residential buildings, and religious facilities, as you all correctly guessed, were receiving the lowest level of acceptance. So I will go ahead and stop sharing that poll. Great. And so kind of moving into the scale of acceptance for wastewater monitoring, we also wanted to understand what participants thought about monitoring wastewater all the way from a national level all the way down to individual household level. And just as a note here, we did make it clear in the survey that it's not possible to trace information back to individual persons or households through wastewater monitoring, just to avoid concern. But somewhat unsurprisingly, we saw kind of a linear decrease when it came to monitoring wastewater at a national level, regional level, cantonal level, kind of big city level. That was all fairly acceptable. But then as we got smaller and smaller, going to small villages and individual household levels, we saw that the level of acceptance pretty dramatically decreased here, which is great for us to keep in mind in the future if there are wastewater monitoring programs that are looking at smaller scale testing. So then we also, towards the end of our analyses in the survey, also wanted to understand what items might predict general acceptance of wastewater monitoring. So we ran some analysis and specifically analysis of variance models using R to examine general acceptance of wastewater monitoring by various sociodemographic indicators. And what we saw was that level of education and level of income were significantly associated with general acceptance of wastewater monitoring. And here we were using a p-value of less than 0.001. And then we also ran ANCOVA and MANCOVA models in R to examine general acceptance of wastewater monitoring by level of trust in one of the major federal institutions in Switzerland that is involved in wastewater monitoring. That's the Swiss Federal Office of Public Health. And what we did see was that level of trust across three indicators of trust were significantly associated with general acceptance of wastewater monitoring. However, we did see a few things that were not associated with general acceptance of wastewater monitoring, and that included Swiss nationality, canton of residency, which again is kind of like a state, gender, and language region being French, German, and Italian. So as I mentioned at the beginning, there was an option at the end of the survey for a little bit of qualitative feedback or a little bit of commentary. So as the very last question in the survey, participants were given the option of providing anything else, any commentary related to wastewater monitoring that they wanted to add. And this actually yielded quite some rich information. So we received about 240 or so comments out of the 1,000 clean participants that we had. And we received a lot of positive and thoughtful comments. I'd just like to share 4 short comments with you today. The first one, these are translated from either French, German, or Italian. The first one saying, water analysis is great. If the problems were then actually taken care of, that would be great. But right now it's all talk and little action. Monitoring diabetes or overweight and taking preventative action would be great. But unfortunately, nothing's going to change and there's probably not enough money in it. So a little bit reflective about, firstly, financial investment in this topic, and also maybe how we can expand in a way that's thoughtful and also communicating the results to the public in a good way. And then secondly, I believe that wastewater analysis represents a clever and practical approach to assessing our impact on the planet. It's about understanding our footprint on the environment and not monitoring the population. So really interesting feedback, kind of encouraging us to focus maybe on those environmental indicators and less so on anything that could be potentially perceived to be an individual lifestyle indicator, or that could be seen as personal surveillance, perhaps. And then we also received some follow-up questions and suggestions that I think will be really useful for further research. Again, the cost question: how much does it cost? Who pays for it? Can we also measure the evolution of pollution, like pesticide content? So again, both the environmental question and also the cost question. And then the last one here, the topic is quite new to me and very interesting. It would be useful to link an in-depth article with the survey explaining what is technically possible today is technically possible in the foreseeable future as well. I'm thinking of the movie The Island with the analysis of urine. So I haven't seen that movie, by the way, but I think that this is really kind of a call to action, that we communicate wisely and clearly the results of this survey, and also any work that we're doing within wastewater monitoring in Switzerland with the general public. So just to kind of wrap up, what have we learned through this survey and through this project? We've seen overall high awareness and high acceptance of wastewater monitoring in Switzerland. And we've also seen that what is monitored in wastewater and at what scale really needs to be carefully chosen and communicated to avoid both public backlash and also mistrust, because that can be a kind of a privacy concern for folks, as they indicated in both the qualitative comments and in some of the granular data. Thirdly, trust in federal institutions like the Swiss Federal Office of Public Health is important and could potentially be an indicator of acceptance of wastewater monitoring. And then lastly, I mean, this is great news that many participants wanted to learn more about this topic and felt that it's an important topic to discuss and learn about. So from our end as scientists, we need more communication, and communication that's transparent and accessible surrounding wastewater monitoring. So with that, I'd just like to really genuinely thank all of the collaborators on this project, both from AVOG and from EPFL, especially my supervisor, Tamar Cohn. And thank you very much again for the opportunity to present this work with you. I'm happy to take any questions that you might have. Thank you.
Thank you, Sophia, for your nice presentation and showing us your research. So we have one question from Ali. So did the survey participants received any kind of payment or incentives to make the survey? Yeah.
Yeah, thank you very much for that question, Ali. Yes, they received incentives directly through the survey panel with whom we collaborated, called Bilendi, and they received incentives in the form of online points that they can accumulate to get rewards through that company.
Right. So there's another one from Rolf. So given that the poll had, the 100 respondents for your survey, so what was the reported margin of error, like in percentage, or like?
We mostly were focused on descriptive results, and we did receive 1,000, not 100 responses. But generally, the margin of error, I will look back in our coding and see if we can share that with you in the comments.
Okay.
Thank you very much for that question.
Yeah, and another one, like, to what extent do you think these findings can be generalized to other countries since these surveys are from Switzerland?
So this survey was inspired in large by a survey done in the United States that was looking at wastewater monitoring, where we also saw pretty high levels of acceptance and awareness. So I'm hesitant to generalize it to other countries, but it's great to see that even across the pond between the United States and Switzerland, there are quite high levels of wastewater monitoring and acceptance for now. But I will say, with the rise of misinformation and distrust of public health in general, it's really important that we kind of get ahead of any potential controversies or data that could be misconstrued by communicating clearly what we're doing with wastewater monitoring before it becomes something that's kind of twisted in a wrong way or misconstrued by the public.
Mm-hmm. So how do you make the communication with the participants? Was it like by like email or by telephone, or was it in person?
So
Or
this was an online survey that was distributed purely online, again, through the professional survey panel company, Belendi. And they were contacting their pool of about 80,000 or a random sampling of those 80,000 participants through email directly.
okay, was there any REB applied to those questions?
Sorry, what is RED?
Yeah, there's a question.
Sorry. REB,
Internal
whoever,
board,
oh, sorry.
IRB, internal review board, so making sure that human subjects are not unethically or unmorally treated.
Yes, thank you, Rolf, very much for that question. I didn't have the time to go into it today, but we did go through the EPFL Ethical Review Board, and we received ethical approval for this project. And I'd be happy to share the details of that with you if you'd like.
Okay, so did you gain any insights from into the reasons why some respondents expressed opposition to wastewater monitoring, particularly among the small group that responded negatively?
Well, we're thinking that part of that had to do with potentially either privacy concerns, personal privacy when it comes to any form of monitoring, whether it's wastewater or data generally, or it could potentially be something affiliated with how they are consuming information regarding wastewater and what wastewater monitoring and whether it's generally positive or negative. But to really get at the heart of that question, which I think is very interesting, I think we would probably need to do a follow-up analysis of some kind, either a focus group with the survey participants or maybe another survey entirely, to kind of really understand what's driving negative perceptions or a mistrust of wastewater monitoring. I think that's a very interesting point.
Mm-hmm. All right. Yeah, thank you, Sophia, for answering those questions and sharing your data. Yeah, so now I think Rolf, you can take over and introduce Moritz.
All right. So our next speaker, thank you, Sophia. Great talk. I hope that we see similar studies from other groups around the world, because it's probably we have different responses based on where we are on the planet. But great to see the Swiss consortium here giving us a perspective. And next up is Moritz Wagner. He's going to talk to us about WBE in practice, methods and insights from Switzerland's public health surveillance. So Moritz, take it away, please.
Great, thanks a lot. I'm just gonna start sharing my screen and just make sure you can see that.
Yeah, great.
Yes, great. So yeah, first of all, thanks, Sophia. Really interesting talk, and good to hear that there's at least some trust in the Federal Office for Public Health, which is where I work. So I'm Moritz, and I'm work at the Federal Office for Public Health in the Division for Communicable Diseases, where I work as part of a data science team, and we do pretty much everything from sort of the raw data processing, the data analysis, up to the publication of all mandatory mandatory reported pathogens in Switzerland. It's sort of above 50. We have several surveillance systems, and relatively new now, we have this wastewater monitoring, and I'm going to share a bit about the experiences and practice that we've had with this from our perspective. So first of all, a little bit something about the wastewater monitoring at FOPH. It really started with this hope, and that's sort of the big potential that we see in wastewater monitoring, is that it doesn't only complement, but in some way completes the surveillance. So if you look at traditional monitoring systems, they tend to cover sort of the tip of the iceberg, or this upper part of the disease pyramid, which is very much based on people feeling sick, seeking care, getting tested, and then those tests being reported to us. So we don't really capture the whole infection process. At the same time, this also introduces a bunch of biases. And one big hope with wastewater monitoring is that it is independent of a lot of these biases, like testing strategies, health-seeking behavior, independent of the whole reporting process, and that it potentially covers a larger part of infections, so potentially asymptomatic or symptomatic infections that don't seek medical care. This does come with a few drawbacks, which we were aware of at the start, is that it doesn't really allow for any individual level interventions like contact tracing. And it's also quite difficult to make estimates about true prevalence or incidence. So actually case counts, what do these wastewater viral loads really mean? I would argue that it's also quite difficult to do that with the traditional systems, but I guess it's even more difficult with the wastewater. However, it is very effective in tracking overall trends. Just to put things a bit into context, here's an overview this is for respiratory pathogens, the surveillance systems that we have. BAG is the German acronym for the FOPH, so it all comes into this big bag. And here on the left, we have the mandatory reporting system, which is sort of the classic case counts that we get. On the left, we have sort of more, on the right, more sentinel reporting systems, where we have general practitioners reporting to us, ARI and ILI cases, and we also used to have, sadly it's been stopped, a sentinel system for hospitals as well. And now part of this is also the wastewater monitoring as sort of a third pillar. A bit on the development of wastewater monitoring here in Switzerland. A lot of this is before my time, but this basically started as a research project at the ERWAG and EPFL, where at the start of the pandemic, they looked at a number of treatment plants and looked whether there was a signal for SARS-CoV-2. This then got expanded, and eventually then in 2022, officially the national wastewater monitoring at FOPH began. Initially, this was just for SARS-CoV-2, looking at the viral loads, as well as the variants, SARS-CoV-2 variants. And then throughout 2023, it was expanded to further respiratory viruses, influenza and RSV. And there are also a number of pilot projects ongoing. Here just one of the first plots. I'm going to have quite a few plots in this presentation because I like plots. This is the number of wastewater treatment plants that were part of the monitoring program. And you can see this start in 2022, where we had over 100 wastewater treatment plants and quite a big program, which covered about 70% of the population. This was then gradually reduced mostly for cost reasons, but also, and I'll get into that a bit, for sort of efficiency reasons. And now we're sort of at, I forgot the number, 11 wastewater treatment plants, which covers about 20% of the Swiss population. So yes, this was for us at FAPH quite a new data source with a lot of exciting new insights, but also a number of challenges. And one main challenge, especially at the start when this big program began with over 100 treatment plants, was comparability and heterogeneity. And we just saw that there were huge differences between wastewater treatment plants. This can have different reasons. So there are different catchment areas, different sampling processes. We saw big differences between laboratories. So initially we started off with, I think it was 11 different labs across Switzerland. And these all had slightly different laboratory methods that they used, where we saw big differences. Of course, you'd expect differences in regions, but it wasn't always clear how much of this was epidemiologically relevant and what was maybe just maybe environmental factors or something else. And we did also see differences within wastewater treatment plants, which could have been, again, environmental factors, but also we saw labs changing their methods slightly, which then made it much harder to compare time series across time. So a few examples. This is, for example, 2 wastewater treatment plants from different laboratories, time series for SARS-CoV-2. And you can just see that they are different. At least the absolute viral loads are have differences in orders of magnitude, quite large. Here an example of, this is all the same lab, and where we noticed at some point that suddenly all the viral loads were slightly higher. We weren't seeing a signal in other reporting systems. We weren't seeing a signal in wastewater treatment plants that were just next to these, but were from a different lab. So then we asked, is there something wrong here? What happened here? And it turns out they changed their lab method, and this resulted in this shift upwards. The sort of approach that we then took was, one was focusing on normalizing results. This was, so basically we introduced this idea of a relative viral load where we would normalize our time series, going away from these absolute viral loads because we just felt like they weren't comparable. And this at least gave us some sort of way of comparing these time series across time. Another thing that we really started focusing much more on was the trends. So really short-term trends, whether the levels were going up or down. And then the other major change was that we did a switch where we really had all our sampling and processing done at a central laboratory, the ERWAG, which now does all the processing for the wastewater. With a new data source also came new challenges in communication to the public. Sophia talked a lot about that, and some really interesting insights. For us, the main challenge is with a lot of other data sources, but also and this one is always this balance between accessibility, keeping things sort of simple and explainable, and transparency, not hiding things and not hiding how complex maybe the back everything that's behind it is. So for wastewater in particular, there was a challenge with the complexity of the data. We had to communicate quite clearly that you had to be very aware of over-interpreting results, and it was quite difficult to. Often we got these questions of, okay, these are the viral load levels, and what does this mean? How many people are infected? And we just had to say we just don't know. Another topic was building trust. Here, we had to always ensure that there was a lot of transparency and in terms of the methodology and publishing the results. And here we got a lot of support from the ERWAG, who are really the experts and understand a lot about the actual process. Another topic was sort of expectation management, where there was a lot of hope in the wastewater, and especially during the time we had a phase where we basically reduced the testing massively, and there were a lot of discussions about now the wastewater shows the true signal, and here we always had to be very careful and always say that decisions aren't solely based on this. It's a complementary system to the other systems. The approach that we sort of chose, and this is referencing now our infectious disease dashboard where we publish all our data, was really we say choose your own adventure, but starting off very simple interactive visualizations, which allow for accessibility. But then through interactivity, you can click through and look more into depth into the data. And if you want to go there, then you can, basically. We also add context through situational assessments, and we add transparency through data downloads and explanations. I did want to show the IDD, but I'm not sure if I'll have time, maybe at the end. So that was sort of the outside view. Now a bit sort of internal, how we've been looking at the data. And here, one big challenge is continuously always this signal versus noise, or signal versus outlier. The data is very noisy, and it's quite difficult to distinguish whether a new data that we get is epidemiologically relevant, or whether it's actually just something else happening that we can't quite explain. Some simple approaches that we went for was we have outlier detection methods where we try and identify these really clear outliers and remove them. And another approach that we went for is that we started looking less at individual treatment plants, but rather aggregating data on a Swiss-wide level, which gives us much more robust trends. One still cautionary advice is that individual values are just always should be treated with care and are only meaningful to a certain extent. But really important for this is, and going back to again this switch to a single laboratory, is that we have high quality data, continuous time series, because that really allows us to calculate robust trends. And one big thing here is that, at least in my opinion, I feel like there's still a lot of scope for future development and refinement of statistical methods. This is really like only the beginning of what there is, and I'm looking forward to what the research community will bring out with these data. What we also look at is we are looking at this data in the context of other monitoring systems. So we also want to compare it to these other systems and see if they're in line or if not, and what the reasons might be. Here are a few examples. So for SARS-CoV-2, here this plot is showing in red the cases. It's on a log scale. In green, the hospitalizations that are reported to us. And in red, the viral loads. This is the population weighted mean for Switzerland. And in the lower plot, we're calculating here the ratio between the wastewater data and in green, the hospitalizations, and the wastewater data and in red, the cases. So if you would expect this relationship to be sort of the same, one-to-one, you would expect it to be basically a horizontal line. And if there are any changes, then it would be changing, basically. And what you can see quite clearly here for the cases is that there was a change in the end of 2022 where this relationship seemed to have changed. Here we actually have quite a good explanation. In 2023, we adapted the testing strategy. So we know that much fewer cases were reported to us. You can also see this quite big drop here in the red line. And quite interesting here is that we saw this change in the relationship even before we adapted this testing strategy. So here, there seems to be a quite clear explanation why this relationship has changed. We can also look at the other pathogens and other surveillance systems. So here we again in red have the cases, in blue the wastewater data, and in purple these box plots are the Sentinel data that's coming from general practitioners. And I'm always really surprised how amazingly they fit together, and really how in the wastewater you really clearly see a very similar signal to what the other reporting systems are showing us. Yeah, I'm always amazed by it. One big hope always was at the start that this wastewater data would give us some sort of early warning signal, with the idea, oh, it's covering, going back to that disease pyramid, it's covering a larger part of this pyramid, maybe also asymptomatic cases. And if a wave begins, it usually takes some time until the symptomatic cases are reported to us. So really a big hope was this could be an early warning signal compared to other systems. And for us, so far at least, we don't really have clear conclusions for this, and can't really see that say that we see a much earlier signal in the wastewater. So here for influenza A, the bottom plot is the growth rate. So basically, at the start of a wave, if in the cases or the wastewater viral loads are increasing, you'd expect this to be above this red line, and it's a bit similar to the R number that you might remember from the pandemic. And really, we can see that at these inflection points at the start of a wave, there isn't really much difference in when the signal starts in the wastewater versus the cases. So this has been a little disappointing. We don't really know why, but we're talking with ERWAG, trying to figure out, and maybe it's also in the methods, and in this is a very simple approach. Maybe there are other statistical methods that could get to the signal. Another interesting aspect, like in the first example, is when we compare systems and we don't see the same trend, so we see deviations. And for the testing example, it was quite clear, but recently, like in the last year, when we've seen this is for SARS-CoV-2, it was really difficult to interpret. And so, for example, here at the end of autumn 2024, we saw a slight increase in our traditional systems, while wastewater didn't really see as much of an increase. And then later in the summer, we basically saw the opposite. And we discussed with the ERWAG, we had a lot of theories, maybe a new variant that is just not being picked up so much in the wastewater, maybe testing being more intensified because it's the start of the winter season, and then sort of the opposite reasoning for the summer season. But it's really quite difficult to say what is driving this, and maybe it also is just noise, and we're overinterpreting these results. So that's been quite tricky so far. But in general, the learnings are that we see incredibly good agreement with existing systems, and this is quite reassuring for both the wastewater data as well as the traditional systems that we have. So the learnings from this, this switch to a single lab for us really meant a lot, helped a lot. It standardized the methodology, reduced variability, and ensured comparability. This point, I'm not so sure it worked for us. For us, really, and finances played a role in that, but we really realized that the quality and representativeness of wastewater treatment plants seem to be more important than having plenty of wastewater treatment plants. So kind of less is more. And as in the last few slides, you could see that it really complements existing monitoring systems, and results are in line with those. I have a few more slides, but not so much time. But it's just a bit about the future. Currently, we're monitoring 3 pathogens and 4 other pathogens, and AMR methodologies are being developed and covering roughly 23 or 20% of the population. The variant monitoring covers a little less. And in terms of the future, we really have as a goal, we want to institutionalize the wastewater monitoring and see it as a part of to become one of the traditional systems. And this is both for endemic as well as pandemic preparedness. We want to build a sustainable and adaptable system that could maybe be upscaled in certain situations, something dynamic. And we're also looking into extending it to other pathogens. And here I just have a few food for thought questions, but I think I'll end it with that, and you can open for questions now.
Great. Thank you so much, Moritz. It's a lot of data. Let's see, we have at least one question here that relates to the outlier analysis. You showed us a plot where you had 2 extreme outliers, and the question is, what were the statistical methods to analyze your data with respect to outliers?
For the outlier detection, we use quite a simple approach. Sort of, don't know what the formal definition is, but we assume a normal distribution across time, and if it has a certain amount of standard deviations away from that, then we classify that as an outlier, and it actually works quite well. It's a very simple approach, and it's sort of always on a rolling time window. So I think it's sort of 2 months, and we look in that 2-month period, is there something that's far away from this normal distribution, and then if yes, we flag it.
Thank you.
But we also, maybe to add to that, we also have a process, a more qualitative process after that. We flag these outliers and tend to first not publish them, and then usually we go back to the EVAC, to the lab, and ask, can you have a look at the sample? Did something go wrong? And sometimes they say, oh yeah, we'll redo the analysis, and actually it changes, but usually actually it doesn't change. And then we say, we publish it, but we mark it as an outlier.
Thank you. And then you had a kind of a plot about the gestation of implementing wastewater-based epidemiology with, in 2023, you had 3 pilot studies coming on: antibiotic resistance monitoring, polio, and then you had MMR, and I think some of us don't know that acronym. Is that methicillin resistance to, or what is it?
Yeah, it's measles, mumps, and rubella. So it's actually 3 pathogens. Yes, yes. So that was, I wasn't so involved with that, but there are a few pilot projects where, for example, for measles, there was an outbreak that we saw that was reported, and we actually then had a pilot project where we looked at that location and whether you could see that outbreak, a signal in the wastewater, and I believe you could.
Okay. Let's see, so what I heard in your presentation is that you initially gave us the pyramid, right? And you said there's all these outcomes, and we feel that wastewater-based epidemiology can be helpful. And then on slide 22, you told us that it really didn't work that well. But on slide 23, you said you're amazed how well it fits. So can we take you back to slide 22? There was no label on the y-axis, and it showed the correlation where you said that the green and the red line should be horizontal if in an ideal world. But since you don't have a y-axis label, I assume that the line in the middle is 1.0. Do you know what the scale is? Is it 2? Is it, what's the increment here? Because we don't know how much it's off. If you look at 2022, how much are we off here from the ideal value? Do you know that?
I don't quite. I think this is
Okay.
yeah, I don't quite. I mean, here, yes, I did. I was naughty and I left off the y-axis, but more to show
Okay.
what this change. And for us, really, it's not so important that what this relationship is. It's more seeing that it's stable in some way. And when it's not, when we see this change, like where we saw the shift going upwards, to understand why. Is there something in the wastewater that is changing, or is there something in the case reporting?
Yeah, but I'd like
really
to kind of reconcile your statement. If you go to the next slide, then you said here you were really enthusiastic, because you said that it never ceases to amaze you how well it works. So, but we are caught here in the between two contrasting views, and I want to relate this to a question from the audience. What does it take to institutionalize WBE? I personally feel there couldn't have been a better place in Switzerland to do this. I know that ERWAG had been doing these studies for 10 years before on drugs. They have some of the best analytical equipment. The population is mostly connected to wastewater treatment system. Public health acceptance, for serving is very high. I can't think of a place, that is almost more ideal than doing this. And then I think we will never again spend as much money for monitoring of wastewater as we did during COVID. So billions of dollars have been spent in a place that looked ideal. And then your conclusion from all of this is that it didn't have a lot of early warning characteristic necessarily, and you were disappointed, at least with respect to COVID, that you didn't see a good correlation. So where does this leave us? But you have enthusiasm for the other results. So where are we here? Was this a waste of money?
No. Yep, that's a very valid question. And yeah, maybe I've just to backtrack on this graphic. For me, this really wasn't first of all, maybe two things. There's one, this was pre-2023 was really a phase of more pandemic time, less normal time, normal testing, normal sort of reliable results. So I think this was really the shift that you're seeing here was something we were expecting, and I would actually say for me this isn't disappointing to see this. This is actually quite good to see this, that we see that even though testing strategies are changing, the wastewater is staying consistent in some way, and that is really showing us that it's still giving us this signal, even though the other traditional systems are being adapted. Yeah. So that's maybe one thing I'd say. And the other thing is that these plots they're basically post-pandemic, and this is sort of what we've seen since then. We now have almost three winter seasons where we do see very consistent results. So sort of in an endemic situation, the trends do align very well. I don't know if that kind of answers your question. Great, and in terms of maybe one little pitch I would also give is maybe going back to this and this sort of phase where we had over 100 treatment plants. I think that's a huge resource, and there was a lot of money spent on it. But I personally at least think this is really a big chance. We have a lot of data for this time, a lot of heterogeneity, but that also might allow for a lot of interesting insights and a lot of interesting trying to understand what are really the factors driving these viral loads. And I'd want to open to anyone. The data is public. There are some research groups looking at it, but this is really a phase where I feel like there's a lot that can be learned about wastewater data.
Thank you, Moritz. So our time's up. Thanks for 2 wonderful presentations today. Thanks everyone for dialing in, and please look at the information that was posted by Tamina for future talks. Bye, everybody.